Thanks, Louie.
Hi, everyone. My name's Ian, and Jackson and I are the two co-chairs of the NLC, the Neighborhood Leaders Council. I'll pass it on in a second for Jackson to introduce himself. You can think of the NLC like the United Nations of neighborhood associations. It's where we come together to discuss big ideas. We are like the ancient Greeks coming together to the Agora to discuss the issues of the day, solve the most pressing issues, and debate the philosophical core of why we're here. And so tonight, Jackson and I are here. I'm making Jerry laugh, so that's a good start. Yeah, while I don't take myself seriously, I take the work really seriously. So yeah, Jackson and I are here as co-chairs to talk, about neighborhood vaccine clinics and the opportunity that's there, and it truly is an opportunity, as well as offer an ask to you and a potential resource. But this is one of the kind of extant pieces that came out of our strategic planning process, and really why the NLC exists, to empower our members. Jerry's the member of y'all's neighborhood association, and yeah, we're really excited tonight to talk about the work and the opportunity, and to be able to hear from y'all. So with that, I will pass it to Jackson.
Yeah, thank you, Ian. So I think the vaccine clinic is a unique opportunity that the NLC has to where neighborhoods could actually do this and make a real difference in beating back the pandemic. And I think neighborhoods are uniquely positioned because the organizations kind of know what's happening on the ground. And I think that what Whitaker Community Council did is really amazing. So this is like an incredible thing that they pulled off. And I'm really proud to be a member of the NLC and just be part of this.
And with that, oh, go ahead.
Most of the people here don't know anything about what the WCC did or about the proposal you set forward to encourage other neighborhoods. So.
Excellent. Well, that's what I'm here to talk about tonight. So right. the title of this presentation is Nothing About Us Without Us. And that's a refrain that's commonly used in public health because it really gets to the core of what we're talking about tonight. We are, of course, talking about preventing COVID-19 infection and transmission, as well as vaccinations. But what we're really talking about is how to foster equity in your neighborhood. And so I wanted to move on to this. Can everyone see a blue and white slide in front of you? It says COVID-19 response up top. Yeah, so the Whitaker Community Council, we're the neighborhood association based in the Whitaker, but we're actually a 501c3. We're a nonprofit organization first, and one of our functions is serving as a neighborhood association. And so since July of last year, we've been in an ongoing way addressing COVID-19 infection and transmission through a public health campaign called All for One and One for All. And we just started doing a vaccine campaign starting in March, and that's going to be ongoing moving forward. And so we have proposed neighborhood level vaccine clinics. And again, this is just an opportunity. We have no commitment currently by Oregon Health Authority, but we do have interest from Lane County Public Health as well from the city of Eugene. And so April is our prep month where Jackson and I are going and kind of doing the road show, as it were, to different neighborhood associations, gauging interest and resources. And then May through November, that would be the time that we would talk about what it would take to do rollout. So let me talk a little bit about the All for One and One for All campaign. It's funded by the Oregon Health Authority. The Whitaker Community Council has received about $120,000 so far through a outreach, engagement, and education campaign designed to keep renters, elders, and the unhoused community safe. So those are three vulnerable populations in our neighborhood. And it's informed by the latest information from the CDC and Lane County Public Health. And it's done in partnership with homeless service providers, Whitaker businesses, as well as Whitaker neighbors. And really, in order to do that, we had three different teams: procurement, communications, and distribution. And I'll go into all three. And so procurement was really focused on getting the resources that we needed to keep people safe. So we hired local folks, and we partnered with Whitaker-based businesses that you can see on the right-hand side. And we spent our money mostly in ways to keep people safe. About a third of our money we spent on PPE. About half of our money we spent on graphic design, advertising, videography, and about a quarter of it we spent on infrastructure. And tonight we're not going to be talking about how to be able to get a ton of money for your neighborhood association, because unfortunately this grant opportunity is closed. But what we are here to talk about is what we learned and the parts of this that we can replicate potentially in other neighborhood associations. So we spent about a third of our money in the Whitaker. We kept that money in our community, focusing on people who are disproportionately impacted by COVID and elevating their voices and increasing the amount of resources that went to them. And so the way that we communicated, like, I just wanted to say, like, why did we choose renters, elders, and unhoused neighbors? And this goes to the core of what we did, and that's really focusing on how to increase equity. So our unhoused neighbors are twice as likely to be hospitalized from folks that are housed, between 2 and 4 times more likely to require critical care, such as intubation, and 2 to 3 times more likely to die. 82% of the Whitaker residents are renters, folks like me. I live at the corner of 5th and Almaden, next to 6th and Chambers, renting a house that's about 90 years old. And some are facing huge debt and looming eviction. And these folks who are facing looming eviction are disproportionately more likely to become unhoused. And as I mentioned before, those folks are more likely to die and require critical care if they get infected with COVID. And our elders are, again, disproportionately impacted. They themselves are vulnerable because about 30%, about a third of Whitaker residents live at or below the federal poverty line. And it's especially hard on our older residents on fixed incomes. So we've been working in tandem with our partners at Lane County Public Health and the Oregon Health Authority on all of our communications, particularly those on infection and transmission prevention. And so this kind of gives you a sense of what we've been doing. Our campaign, All for One and One for All, is really focused on the 4 things that all of us can do to keep the ones who are at highest risk safe. And those 4 things are pretty basic, but they're informed by science, and they've been told to us time and time again by our partners at Public Health. Cover your nose and mouth when you wear a mask, stay 6 feet apart when you're socially distancing, wash your hands for at least 20 seconds, and get tested regularly. In the upper left-hand corner here, you can see Akon and Gloria Udasenko. They own Equiano Coffee in the Whitaker. They're 2 business owners. In the middle, you can see Okra. He's a member of our unhoused community who's been unhoused for 30 years. And on the right, you can see a family who rents. And on the bottom, you can see how we communicated our message on billboards, on sandwich boards in front of some of the most well-known Whitaker watering holes like Oakshire Brewing, as well as bus ads that are still running across the city. But we just didn't do that. What we also did specifically was work with our unhoused community to distribute these. So you can see the One for All for One branding, but inside these water bottles are PPE. This is some hand sanitizer, and this is a mask. And so there on the screen, you can see how we distributed these resources to our partners who are unhoused service providers, as well as working with local businesses. This wonderful gentleman here is Nelson from Nelson's Taqueria. You can see one of our sandwich boards with members of our elder community, folks above the age of 65, as well as a hand sanitizer refill station. So members of our unhoused community, as well as just members of our community, could go and refill their hand sanitizer. And you can look there, it's All for One and One for All. So the branding is really designed to strengthen and elevate those voices that are disproportionately vulnerable to COVID so they can explain to themselves how to prevent it. We're elevating their voices so they can keep themselves safe. We also partnered with members of our community that were, again, disproportionately vulnerable, but we did it in a way to empower them. So we worked with Akon and Gloria, an African-American owned business in the Whitaker, to buy incentives for getting tested. So we partnered with Eugene Springfield NAACP for this Black community COVID testing event to be able to have Black members of our community be tested while at the same time enfranchising a business that was African-American owned. And again, going back to the water bottles and hand sanitizer, we distributed about 3,000 water bottles to these partners on the left and about 50 plus gallons of hand sanitizer to these businesses on the right. And so here we get into the meat and potatoes. All the stuff before is awesome. Yeah, it's really great information. It's informed by the latest science. But what I came to talk to you about tonight is the vaccine clinic. And it was held on Friday, March 12th in partnership with Walgreens. It was the largest vaccine clinic for the Johnson & Johnson Janssen vaccine south of Portland, vaccinating 500 people. And it was organized in about 72 hours with 20 plus volunteers and 100 plus volunteer hours. And it was done in partnership with a ton of folks such as Lane County Public Health, Oregon Health Authority, and the Chamber of Commerce. And what I really came to talk to you about tonight is exactly this. What Oregon Health Authority and Lane County Public Health and community-based organizations such as the Whitaker Community Council are pivoting to right now is how can we conduct community-based vaccine clinics? What we're hearing from our partners in public health is that people trust each other if they know each other. And a lot of folks are vaccine hesitant, meaning they have deep reservations about the vaccine safety, where to get good information on the vaccine, and when they should get it. But if they come to folks who are trusted, their neighbors like us, they're more likely to feel comfortable, safe, and also access the vaccine. because we're not only a trusted source, but we might be able to be ones who reduce barriers to access. So what we learned, in short, a ton. We learned a ton about how to be able to put something on, how to be able to secure a physical location, create intake, as well as be able to create the survey instruments to triage eligible people. So the two things you see on the right are our after action report that we shared with our partners at Lane County Public Health, as well as Oregon Health Authority, and I'm happy to share that with y'all. But in short, we made a ton of mistakes and we learned a lot from them. And hopefully what we're going to be doing in the future, come May, when the floodgates open and supply drastically increases of the vaccine, is be able to work with our partners at Lane County Public Health to do this not only in the Whitaker, but see what the appetite is for other neighborhoods, so that the Whitaker Community Council can work with NLC, the UN of neighborhood associations, to be able to aggregate resources. So we together might be able to host vaccine clinics in neighborhoods outside of the Whitaker. So our vaccine communication strategy, our goal is to increase education, outreach, and positive behaviors that increase public health. And fundamentally, this work is about increasing equity in public health. How can we redistribute power to vulnerable communities, create systemic and organizational change, but also at an interpersonal level? You know, the work that we've been doing in partnership with NAACP and our unhoused community is, again, really redesigned. It's designed to kind of redistribute power, to enfranchise people and make sure that their voices are heard. But it's also done to increase access. We know that communities that are most impacted by things like racism, ableism, and systemic inequality don't have access in the ways that other communities which are not impacted by those things, especially public health. So as neighborhood associations, we might be best positioned to be able to reduce some of those barriers and increase access. And last, we're all about kind of increasing positive behaviors. You know, already people are trying to take off their masks. Public health is like, you gotta keep doing those things that we know reduce transmission and reduce infection. So as neighborhood associations, I would say we need to continue to encourage things like social distancing publicly, wearing masks, washing our hands, and getting tested. And so this is our audience for this work. You know, we're actually not focused on people who are vaccine opposed, who don't want to get the vaccine, or vaccine active, people who are searching it out, people like Jerry, who are now going to be dancing in the streets that they've gotten their 2 shots. What we're actually focused on are these 2 groups, people who are vaccine passive and vaccine hesitant. So vaccine intent is the y-axis here. How likely are you to get the vaccine? And the x-axis on the bottom is vaccine behavior. How likely are you to reach out and seek information on the vaccine? So the vaccine passive folks are open to getting the vaccine, but they're not seeking information out, versus the vaccine hesitant folks, they're unsure about the vaccine, but they are seeking information. So what does this breakdown look like? So we've got this information from Oregon Health Authority, and we found out that, you know, again, we're not focusing on these 38% of people that are definitely getting the vaccine, or the 19% that are definitely not, but we're focused on this 20% group that will probably get the vaccine. And this group here, that's 22% are probably not getting it, but 11% are unsure. And so I would say the most interesting group here is the 31% of folks who either will probably get it or they're unsure about getting it. And I would encourage us as neighborhood associations to focus on those groups, because that's the information we're getting from Lane County Public Health. So what does our communications campaign look like for vaccine in the Whitaker? It's all about science communication, how and where to get trusted vaccine and COVID information, vaccine confidence, again, elevating those voices and stories of Whitaker community members who've gotten the vaccine. For y'all, it might be elevating voices of folks like Jerry, you know, why he got it and why he feels confident, and talk about vaccine commitment too. In the Whitaker, we're encouraging folks to sign on and receive the vaccine. There's some great science out there that's just emerging that says people respond better when it talks about your vaccine. Your vaccine dose is waiting for you. You know, I don't know if y'all have ever gotten those things in the mail, those kind of like personalized labels, right? I always get them from ACLU, right? And it says like Ian Winbrock, it shows my address. And now I'm like, oh man, I got to send the ACLU money because they already sent me this thing. You know, if we send things in the mail through our mailers and the funding that we get from the city saying that, you know, your vaccine dose is waiting for you at this clinic during this time slot, I think people are going to be much more likely to approach the vaccine clinics with confidence. So this is the big ask, you know. What are Jackson and I here tonight to ask you? It's to consider this. Consider this opportunity to look at May through November, the 2nd and 4th Sunday, to hold that for vaccine clinics. how can you in your neighborhood, or maybe if you don't have the resources and person power, maybe working with another neighborhood that's interested, to look to serve between 200 and 500 people at a clinic, and then work with Jackson and I to have the proof of capacity. Know that y'all have the resources, the person power, and the kind of infrastructure to be able to host a vaccine clinic twice a month. And what does this opportunity with Oregon Health Authority look like? I'm on a lot of really fun calls. It's a privilege to be the dumbest person in the room. I do not have a background in public health. My mom is a master's of public health, and my sister too. So we talk about public health at the dinner table. We did when we were growing up, but this is definitely not something that I have a professional background in. So Oregon Health Authority right now is exploring financial support, coordinating requests for vaccine allocations, connecting with event hosts and vaccine resources like vaccines or vaccinators. And they're also connecting people with branch managers for places like Walgreens that are coordinating vaccines statewide. So what would the role and responsibilities look like for a neighborhood association like yours? It could look like securing an indoor physical location, securing volunteers for the clinic. We had 20 volunteers at our 500-person clinic in the Whitaker, creating a registration system for intake. We have one that we use in the Whitaker. We'd be happy to share it with y'all. Setting up the infrastructure, tables, chairs, marking social distance places with tape, promoting the clinic on social media and by word of mouth, staffing the clinic with volunteers, breakdown and cleanup, and then creating an after action report like I did so that we can share that with public health and so that we can all learn from each other. So what do next steps look like? It's a presentation like the one that I'm doing right now, and maybe a discussion and a vote from your board. It would be a consultation with Lane County Public Health and the Oregon Health Authority, and consultation with the city of Eugene. And all this would be done by Jackson and myself through the NLC. And then at the April meeting of the NLC, which is later this month, Jackson and I would bring together both the resources and the organizations that are interested so we could do some matchmaking. Be like, well, River Road has the interest, but it doesn't have the capacity. And then, y'all have the physical location, but you don't have the volunteers. So we would bring you together to be able to potentially host a clinic if Lane County Public Health and Oregon Health Authority were down. And so what do the vaccine clinics themselves look like? What we're pitching to our partners in public health are the second and fourth Sunday, May through November, between 200 and 500 people served. And it would be guided by the expertise of our partners in public health. And the last thing that I will say is this going to work? Maybe not. We don't know. And frankly, this whole experience has just been an arc of learning. We've been at this since July of last year in the Whitaker, but we certainly aren't experts. We're flying by the seat of our pants, really just focused on how we can serve our community. And the reason that our partners at Public Health reached out and partnered with us is because we're experts in our own community. And y'all are experts in yours. So I'm hoping that we can have a conversation and do some question and answer. And please feel free to, after the meeting, if you have any questions or comments, reach out to Jerry, and Jerry has Jackson and I's contact information so that we can continue the conversation. But I just wanted to say thanks for giving us a chance to come and present tonight, and wanted to open it up to y'all for any initial questions or comments about the potential opportunity that exists or the resources or asks. And the last thing that I wanted to leave you with is that the Whitaker Community Council has a lot of hand sanitizer. And so if your community is in need of hand sanitizer, let us know. And we might be able to connect you with some gallons of hand sanitizer we have in surplus, because ultimately this is about neighbors helping neighbors. And Jackson and I are really committed through the NLC to be able to empower y'all to keep each other safe. So just wanted to say thanks again, and really looking forward to finding ways that we can work together through the NLC.
Jerry, then Mary.
I was going to mention that when he presented this at NLC, I thought, well, I'm not really sure where we're going to find our clientele. There's homeless people here, and there's housebound people here, but we really don't have contact with them, and so that's a challenge. By the same token, we can probably build capacity by, like we did with the neighborhood plan, by joining with the River Road group, and I think they have probably a better contact with those kinds of people. So So I don't know. It's a heavy lift, but it's interesting.
Yeah, and I just wanted to quickly say, Jerry, that we're focused on those 3 vulnerable communities because the way that we're approaching it is a way to reduce systemic inequality in public health. But the reason that we're focusing on May clinics is because that's when the vaccine's available to everyone. And there's not going to be enough people at public health to put vaccines in arms. And so they're going to be looking to people like us to be able to host clinics, because really the name of the game is vaccines in arms. And so, yeah, the kind of whisper on the street, virtual street, is that there's no wrong arm for a vaccine. So if y'all were to focus on, just people in your neighborhood, I think that would work really well. And again, I'm not a public health expert, but if y'all are willing to chat with River Road, I would be willing to take that back to our partners in public health and say, hey, this is the interest that we have, and is this something that's workable and fundable through public health?
Yeah, and can I actually add something to that? You can get the vaccine as a leftover at Walmart if you go and they have extra vaccines. So I got it yesterday, and some of my neighbors have actually been hesitant to get it. So I was able to persuade one of my neighbors, to go get it today. She was like, I'm not sure I want to do it. And I said, this is something you need to do. The science is sound on this. And she went and did that and got that at Walmart today. So I think that, as neighbors of people, we have a certain sort of power to influence them. And this is a real opportunity to do that. It doesn't have to necessarily be with homeless people or the same groups of people that the Whitaker has focused on. They just have a unique position to do that. In my neighborhood, there's not that many homeless people or unhoused people, I'm sorry to say, but you have influence on your neighbors, and you can make this happen for people and make a difference to reach herd immunity and beat back the pandemic.
Mary, you're next, and then I'll put myself in the queue.
Okay, one vulnerable population I mentioned to Kate when this first came up is we've got a lot of farms around here, and so there are a lot of Latinos here who we have at the Huerta, at the garden. If you go to any of the local farms, if you go to Groundworks, you see all these Latino farm workers, and that may be a vulnerable population that's peculiar to Santa Clara we may work on. I have no idea how to make those inroads. I mean, I guess we talk to people who run Huerta, and we talk to some of farmers, but that I don't know. But that was not my question. My question for Ian was, how do you find and target the people who are vaccine hesitant? And you also said you made mistakes. What were the mistakes?
Oh, man, good question. So how do you target vaccine hesitant people? I think you just be yourself, and I'll just say this. We vaccinated Emily Simple.
No. I'm saying, how do you find them? Like, how do you go, oh, I think they're vaccine.
Totally. Great question. And I would just say that there might be vaccine hesitant people in this Zoom call right now. And so how do you find them is that you just do a good job of connecting people already. I think there's a lot of vaccine hesitant people that are coming to public meetings that are already engaging, and you just have to consistently put yourself out there on social media, in your own newsletters, in your interactions, like Jackson's. That was a great one. Emily Simple, the city council member who represents, I think it's Ward 1, was super vaccine hesitant. And she saw our announcement, and she called up one of our volunteers and was like, hey, it's been 20 years since I got a shot. I don't want to really talk about why I haven't gotten it, but it's not really for me. And our volunteer was like, oh, you should do it. It's going to be okay. Here's the science we got from CDC. Like, here's the link to it. I think you're only going to need 1 shot because it's the Johnson & Johnson. You won't need 2. And it was just talking to someone, like a voice from a community. The person was not a nurse, right? And they didn't give any public health advice. They just said, here's the link that we got from Walgreens that's on the CDC website. And it was because it was coming from somebody who they felt more comfortable with. And again, this is a city council person. I mean, they probably know more about the ins and outs of this stuff than I do. But I think that how do you reach vaccine hesitant people? I think you just reach people. And some people are vaccine hesitant. From the data that we're getting from OHA, a lot of people are. Like 33% or more are vaccine hesitant. And so like maybe 1/3 of the people in the room are vaccine hesitant. And I'm not here to judge. I'm just here to say that that's totally normal. And we should kind of recognize how normal it is and work with each other to solve it. The mistakes question's great. I have a whole 12-page report full of mistakes that I can send to you. But here's Ian's top 3. We vaccinated a bunch of people who weren't eligible. Oops. We had, once you open these doses, you've got 6 hours to use them. We made a judgment call. Our chair was like, we got to do it. And so that was something we did. What was mistake number 2? People who were eligible didn't get the vaccine because we were drinking from a fire hose. We did organize this in like 72 hours. So I was like texting people at like 2:30 in the morning. This is your appointment. This is your appointment. This is your appointment. And so some people, we couldn't follow up with them. I think having more volunteers doing the intake is really important. And that's something that we learned and that we made a mistake on. And then number 3 is, make sure that you have realistic expectations of what you can accomplish. We really pushed ourselves to do 500 doses, which was great. But I think that we could have done a better job with 300 doses. If we really focused on doing something small versus doing something big, but we, 500 doses were had. And so we went for broke. So I would say that, understand that you're going to, if you do this, you're going to, vaccinate people who might be ineligible, but that's why we should wait until May, right? Because that's when we can do it for everyone. And that some people who sign up or get a confirmation email might not get the vaccine when they say they do, because, I'm no expert in this. We did our best. And then last is, just kind of being realistic that this is a learning experience. I talked to a lot of angry people. Our volunteers got some pretty nasty comments, right? Because people were really looking forward to getting their vaccine, but we're not experts. So we did the best we could.
So I'm in the queue and then Jerry. So I just wanted to ask a couple questions, Ian, about liability. Like, do you need to provide liability insurance for something like this? And do you have professional nurses giving the vaccines? And I had a brief conversation with John Belcher today about perhaps partnering with River Road Community Organization and maybe doing an outside clinic under the pavilions at Emerald Park. And what would that look like and how many volunteers? And we get back to that question that Mary was bringing up, like how do we really reach out to our more vulnerable or less likely to access vaccine members of our community? And we thought that perhaps our bilingual schools, particularly before they get out, would be a great way to access those families and be able to provide them with an opportunity. And perhaps Central Latino could help us reach some other folks in our community, because I think renters and the Latinx population make up the greater population of people in our neighborhood that are less likely to get served through regular channels. But certainly liability was a great big issue, at least from John's perspective.
Yeah, and we have general liability insurance. We paid $325 to have general liability insurance because it's required for our grant, but also the partner of the indoor space also has liability insurance for it's a former tabernacle. So it's formerly a church and now it's being repurposed as a community space. He's actually a doctor. His name's Dr. Eli Veredas. And if y'all wanted to talk to someone, if you had a person who had an indoor space, I'd volunteer Eli and throw him under the bus right now and say that he'd be a great person to talk to that other person who has an indoor space, because he's a doctor, right? He works at the VA here in Eugene, but also he's just like, this was great. He's totally supportive of it. And so, y'all should definitely get general liability insurance. And I think that it's something that could be fundable under the funding you receive through the city for outreach and newsletters. And I'm in communications with Amy, who's the point person for the city of Eugene for their long-term recovery plan. And to her, she's like, this totally makes sense. How can we recover economically if we can't get the vaccine? So to me, like funding neighborhood associations to do this work through different funding streams that are available either through the city or through Oregon Health Authority or Lane County Public Health makes sense to me. But yeah, you definitely need the infrastructure to make it happen, the physical space, but particularly the liability insurance, because I'm not vaccinating anybody. No. Like it was Walgreens people last time because we were partnering with them. If it was through OHA or Lane County Public Health, it would be folks that they triage. I don't know what they're not phlebotomists. Those are people who draw blood, but I think they're vaccine technicians. I think that's the terminology for it. and they would be the ones, public health, either at the state level or the county level, probably the county, they would be like bringing the people in to do the vaccinations.
So Jerry, you're next. And then Patrick.
Yeah, I think you brought up what I was thinking about, and that was the fact that you actually had a doctor that worked with you, and we would need to set up some partnerships so that we have not just ourselves, but we have people who do that vaccinations and maybe doctors and stuff that would actually be our point people. And so that's pretty much it.
Patrick?
Yes, thanks, Ian. We appreciate and Jackson, we appreciate the 2 cents. I got a couple questions. One, who have you been working with at Lane County Public Health for this outreach?
Yeah, so a ton of folks. I mean, Elizabeth Maglioretto, she works with, I can't remember her title. I think it's Senior Program Manager. She's working on the vaccinations for the unhoused community. Jason Davis is our primary point of contact because he's the Public Information Officer for Lane County Public Health. Mo Young, she's been the point person for the group of community-based organizations that are in Lane County. There's 9 of us, including Centro Latinoamericano, NAACP Eugene Springfield, Black Thistle Street Aid, oh my gosh, a ton of others that I'm just forgetting right now. But yeah, I mean, it's a total team sport on the county side, and there's more people all the time who come in. I'm certainly not privy to all of them, but it's also kind of overlaid with Oregon Health Authority. So there's Oregon Health Authority that are funding the work and hosting these calls, and then Lane County Public Health are coming in. And so community-based organizations like ours, all of whom are 501c3s, are just kind of sitting in the middle. You know, the reason that we're brought in is because we're, experts in our community. That's it. We're not experts in public health, but we just know the people that we work with.
Well, I appreciate that. And I ask these things because, in full disclosure, I'm working for the Lane County Public Health, right in the middle of that stuff. And we're dealing with a lot of these outreach programs. We did one with LULAC this last Tuesday. It was fantastic at the fairgrounds. Would there be any opportunity to have people come to either a mass event at the fairgrounds or smaller events using public transportation? If these impediments were out, is that something that would maybe be enticeful for some people to have 100, 200 type people at a time before the May through November type stuff? Is that something that's an interest that they want to get moving forward sooner, or is it something that it's a hesitancy?
I couldn't say. There's a lot of things that I just don't know because, yeah, I mean, I feel like you probably know a lot more about the Lane County Public Health side than I do. I talk to Jason every once in a while. We have a good rapport. I can give him a ring or send him a text. Elizabeth, and I have worked on and off for the past couple of months. But yeah,
we have a coordinator that's doing these outreaches to specific groups and things of that nature, and we can offline get that information to you, so you have a good contact. And I think that'd be something that if there's a community organization that wants to, hey, we have this opportunity for 100, 200 people multiple times, because you want to get this, you want to get it right the first time. You open the doors and the community comes. How do you do that correctly? Because not everybody trusts what's going on. I mean, that's a fact out there. So how do you do that in the right way? And who do you contact? And it's something that everybody wants, this Johnson & Johnson, because it's a one and done type thing. But there's other opportunities out there. And I'm not a doctor. I'm not going to profess to do that. Just been seeing this a lot lately. And it may be something that's right for certain communities, certain organizations, certain outreach programs, that once they start in the process and they tell someone their pros or cons, and you get moving from that. So I'll offer that from a board member and a community, just a neighbor. There's people out there that we can get you in contact with, that you can have direct access, that deal with Elizabeth and Jason and those things on a daily basis. Wonderful, wonderful group. But being inside the cog a little bit, it's very interesting to see all the wonderful things that are happening. So that's why I want to offer a little bit of help to see if we can't help our community get along. And I think it's going to go faster than you think.
Sweet. Yeah, I just put my email address for the Whitaker Community Council address, so all of the board members have access to that, and it's definitely a team sport. Like, I'm here on behalf of the WCC, but we have, you know, a procurement lead for that team, a comms lead for that team, and a distribution lead for that team. So yeah, totally interested in it. And my offer to you still stands. If you don't want to move forward with the vaccine clinic, but you are interested in the PPE and the hand sanitizer, reach out to that email, or have Jerry reach out to Jackson and I, and I'd love to bring it back to the WCC board because we'd need to vote on it. But I think that we certainly have enough in surplus, and would definitely be interested in going to the board and saying, hey, Santa Clara is interested in having access to some of our hand sanitizer.
Thanks much.
I have another quick question. So in the presentation, Ian, Jackson, it sounded like you were looking for places that were willing to host vaccine clinics twice a month, every month. Is that my understanding? Like, it wouldn't be a one-time event for River Road Santa Clara. It would be something we would need to commit to doing every 2 weeks?
So that's my pitch to you, and you can come back and say, oh, it's totally unrealistic. But I'm thinking, and again, this is my thought, that when lives are on the line, like, every hour counts. And putting on one clinic was great. You know, we did 500, but and probably Patrick can speak to this better than I can, but having this capacity to drastically increase the kind of throughput of vaccines would be a game changer, right? Because I feel that from what I've heard from our partners in public health, that local public health agencies have been saying supplies the issue, supplies the issue, supplies the issue. And now the federal government's calling their bluff. It's like, okay, well, if supplies the issue, here Walgreens have 500 vaccines and use them in 7 days. And Walgreens was like, okay, Whitaker Community Council, let's do this thing. So if we could do even one clinic, that's awesome. You know, 500 more people getting the dose, I think, is huge. But showcasing that continuous capacity to do has a couple of different benefits. And one of them, of course, I'll just be kind of transparent, is I'm self-interested in showing the power of neighborhood associations during a budget crunch, right? I think the city's looking for areas to cut. And if we say this is our value, it becomes really hard for the city to say that we're going to get rid of the funding for neighborhood associations. So that's one reason. And then the other reason is pretty obvious, right? I mean, people are getting sick and people are dying. You know, I've lost community members in my neighborhood to COVID and COVID-related suicide. And yeah, any life that we can save is incredibly meaningful to me, whether it's a one-time event. But I think that if we do it on a continuous basis, it really showcases our ability to, you know, prevent COVID and save lives, but also just the real power of neighborhood associations.
Jerry.
Just kind of a point of order. It seems to me like Dan said that he had a time crunch. I'm not sure when he has to leave.
Dan's good, right?
Oh no, you're fine.
Go ahead, Dan.
You're totally fine. I always yield to Ian. It's way more important than anything I'm about to talk about. So.
Thanks, Dan. Mary?
If we decided to do this, would we be guaranteed that we'd get the Johnson & Johnson one shot?
No, and so I just want to be clear, and Patrick, you can probably speak to this better than I, is that there doesn't seem to be any guarantees. What I've heard from our partners at public health at the state and Lane County is maybe expect a third of each vaccine. Maybe a third will be Johnson & Johnson, but really it's kind of an unknown. Like just recently, I don't know if y'all saw the news, but 15 million Johnson & Johnson doses were unusable. So there's a ton that I don't know. So Patrick, I'll kind of like yield it to you because I'm kind of out of my depth here. And what I've heard from our partners at the state and the county is that we don't know.
So that would mean we would have to be able to set people up, if we did it, to come back at a certain amount of time and get their second shot. We'd have to have something in place for that. That's a little more complicated.
It is, but it's when you get your first shot, then we're going to make sure that you get access to that second shot when you need it. And we're going to have it at the same location. We're going to have the same infrastructure that was set up through the mass vaccination clinics that we have and we run, and we either run 2 to 3 sites a weekend. We get between 10 and 14,000 shots a weekend. that we get into these max vaccination shots. We're having one at the fairgrounds this weekend, both days, and we're having one at the Autzen Stadium both days. And so that's where you have the biggest bang for the buck. It's a drive-through clinic. They have opportunities that we bring people in on buses, on all kinds of different opportunities. People ride their bike. That's why you have in the Whitaker area, you have the fairgrounds are right down the road. So there is some great opportunities. You're not, Mary, you're not guaranteed a certain dose because they're allocated to the state, and then the counties get X amount of that. And right now, you're just not getting a massive amount of the J&J. You may get an influx one week, the next week you don't. And so, but once you get say you do a Pfizer or Moderna prime shot where you have your first shot, then you're going to get those follow-up shots 3 to 4 weeks later for that group. And so that's the benefit of getting a shot in an arm, is then you get more shots to follow up on that second dose in a few weeks.
So Patrick, you're saying Lane County Public Health will guarantee that the second dose is made available. But what Mary is saying is that if we don't do Johnson & Johnson, then we're needing to provide a venue to make it happen. And that's where her concern is.
And I agree, and that is a concern, but I think that because of the opportunities that the county has and the locations that they have, that they can have these different sites. And so if you have these community outreach sites, which will provide with the information, those type of sites, they'll come to you. And then if it's Johnson & Johnson, one and done, and here you go. If it's a Pfizer or Moderna, then they'll follow up with something later on, because it all depends on how much vaccine you're allotted every week. And that's one of the reasons I think there's a hesitancy for a lot of people to come to the max vaccination clinics. They're so easy. They're so much better than actually if you had a smaller clinic. 20, 50 people, that's one thing. But these mass vacs can get so many people done in an hour, and you just drive through. And it's very, very easy. It's painless. Nobody's asking for a lot of information. You sign up on there. They are lowering the criteria for who can get what and when. And so I think as that changes, and again, I'm no expert. This is something I'm involved in. These are things to sign up, come and get it, and go from there. Going to Walgreens, going to Walmart, all these other locations, fantastic resources. How do you get there is going to be one of the issues. And so Emerald Park may have a great opportunity over there that you say, hey, we've got 150 people that we want from this community here, and to be able to do it. And if we're able to do it with the vaccine, say you have enough J&J, great. If you don't and you have this, will that work? Some people are opposed, some people aren't. Again, we had a great opportunity this last Tuesday at the fairgrounds with about 100 people for the Latinx community and La Lucia. I'm going to get it wrong. And but it was a little hesitancy. I was there and helped out. At the end of it, there was a lot of, this wasn't as bad as we thought. And we had people there signing people up for our events this weekend. Well, my grandmother, my mother, somebody is not very mobile. How about getting them in through it? Drive right through. We got Spanish speaking lanes. We have different things that we can do. And it's really easy from the seat of your car. And so that's the kind of stuff that I offer out there. It's very difficult to get online sometimes. I'll be the first one to admit that. It's very confusing. However, they're making it easier and easier and easier to do this type of stuff. So if you're interested, I highly recommend that. If there's a barrier that says we don't have transportation, Elizabeth is here every day. We have our calls, and she's saying, hey, we've got this many people need transportation. Those are the kind of things that I think we can work out as a community through our partnerships, and these clinics can go a long way. Won't soapbox that, but I do think that there's a really good opportunity if people are interested.
I'm Patrick. This is Tim. I'm curious about the logistics of it. So if it's a 2-shot regime, someone comes in, gets their first shot, what do they go away with? They don't go away with another appointment, do they?
No, what they go with, they go with this card and says, hey, I got this spot on this day. And by the way, if you lose that card or don't bring that card, don't worry, we'll give you a new one. We'll give you another one for the next shot. That's not a problem. You go away with that, and then in about 2.5 weeks, we'll call you and say, hey, we've got this extra clinic, and it's not something you have to sign up and try to compete and swim upstream against everybody else. This is set aside just for a follow-up events. So if we do something,
what I didn't know.
yeah, if we do something this weekend and it's a prime event in 3 weeks, then we'll schedule you for the follow-up shot. And so that's why it's very valuable to get in and do those things when you can, because then you're guaranteed the follow-up shot, because that's one of the big things that the county wants to do is get a shot in arm.
And
then
say the date that you're supposed to get your follow-up. So you could go somewhere else if something happens, happen to be out of town.
and they're really opening that up. And literally it's every day is something better and bigger. And so if you got a shot at Walgreens and you want a follow-up shot at Walmart in 3 weeks, that's okay, because the system talks to each other and says, here's what you've got. And so they have that ability to do those type of things, because some people just don't have the opportunity to come back. There is a communities that are out there that just having that second opportunity is very, very difficult.
Well, it's nice that you call them too, so that they can be reminded.
We do. And so people say, well, it's been 3-4 days. I haven't heard from them. Well, give us about another 1.5 weeks, 2 weeks, and we'll call you and say, hey, we're coming to the theater near you. Come see us. We got these spots. This weekend is a mix. It's a prime, which is your first shot, or a boost, which is your second shot. And so there's a mixture of people coming in to do that. And it looks like it's going to ramp up from here for the vaccine availability. And these drive-through clinics serve about 2,500 to 2,900 people a day at each location.
Dawn, did you have a question? Okay. Anybody else? More questions? More thoughts? Okay. Well, thank you so much for joining us, Ian and Jackson, and Patrick. Thanks for all your help. We appreciate it, and we'll get back to, maybe we'll have a discussion online after this amongst the board and anybody else who wants to talk about whether we want to follow up.
Cool. Do y'all mind if I stay for Dan's presentation?
We would love it. You're always welcome to stay.
Right on.
Okay, so Dan Isaacson, would you introduce yourself
Well,
first?
hello, everyone. My name is Dan Isaacson. I wear many hats. I'm a small business owner. I live in the River Road area, so you're my neighborhood association to the north. You're like my friendly Canadian friends. I'm also in the incoming president of NAMI, which is the National Alliance on Mental Illness, and I am one of your planning commissioners for the Eugene city. So any of those hats, I'm always happy to answer questions on. But tonight I'm talking about NAMI, and we typically have a little bit of background on NAMI. So NAMI is the largest grassroots organization for mental illness in the country. We have a chapter here in Lane County. And for those who don't know kind of the crisis that we're in as far as mental health is concerned, Oregon ranks last in mental health funding. I was actually pretty shocked when I started to get involved in mental health. I came to mental health advocacy from a friend of mine who committed suicide 3 years ago. In fact, today is his birthday. So my kind of genesis came from tragedy, which is how a lot of people come to it. And so, you know, for me, it was, I can sit around and become angry and kind of want to lash out, or I can look for something kind of productive to do. So I co-chair the Suicide Prevention Coalition, which kind of is a division of the Department of Health, and that kind of gravitates in with NAMI itself. Lane County is an odd bird when it comes to its funding, even within the bad funding structure that Oregon already has. The Clackamas County, for example, its NAMI, its chapter of NAMI gives $1 million a year from its county government to its NAMI chapter. In Lane County, we give $0 to its NAMI. To give you an idea for what NAMI does around the state and here in Lane County, most police departments ask that their police officers, about 20% go through crisis intervention training. That's pretty standard around the country and around the state. I think the state average is about 40%, so we're a little higher than national average. Here in Lane County, specifically to Eugene, 98% of the officers go through crisis intervention training, and the only agency that's authorized to do that is NAMI. So we do bill for that, which is great, but the reason why we don't receive our funding from the state, from our county, is that there is a privacy issue between the software that we use and what the county is asking for, and neither side is really kind of willing to budge on offering it up or kind of giving in from the county side of the equation. Clackamas just kind of looked the other way and said, it's more important that patient care gets taken care of. So we've been fighting that battle for a long time, I guess. I'm new to that battle. It seems rather bizarre to me, but it is what it is. So, here in Lane County, just to give you some kind of sobering numbers, the suicide rate in Lane County is 4 times greater than 84% of the counties in the country. We'll say it again, 4 times greater than 84% of the counties in the country. If you live in Junction City, Cottage Grove, or Florence, it's even higher. The raw number, just the raw number of dead bodies that Lane County produces from suicide is approaching, and in fact, in 2020, we had a little bit of a dip, believe it or not, because COVID suicide rate went down. But in 2021, it will likely pass Multnomah County. And Multnomah County has twice our size of population. So we, for whatever reason, are killing ourselves at a pretty substantial rate. When you add it in with the #1 county for homelessness, you add in the 10th leading state that has chronic illness, 14th highest in excessive drinking, and you get to get an idea for how one of these blends in with the other. So we're in a bit of a pickle, to say the least. So we do what we can over at NAMI. NAMI provides a number of different services, both for NGOs and governments, as well as the private sector and the population as a whole through support groups. Our principal fundraiser a year is a 5K walk that we do. It raises about $20,000, which is not a huge amount of money for us, but it is our principal fundraiser a year. This year, because of COVID, we're having to do it virtually, which is an odd thing to do a 5K virtually, admittedly. So what we're asking folks to do is to form a team. So I'm making the rounds, talking to different community organizations, different civic groups, and then within their team, coming up with a plan to raise a set goal of money, which is great. Although ideally, I will tell you, my own personal goal would, if we didn't raise any more than what we already have kind of allocated from this, but if I were to turn on my social media and flip through all of my friends and I see this kind of wave of people talking about mental health, how mental health has impacted their lives over COVID, and what their plan is to do about it, breaking down that stigma, I would be a very happy man. So that's one way that we can do it. I personally, as an example, I'll be just walking along the riverfront. I'm going to do a couple Facebook Live posts, talk about some of the interactions I've had over the past year. I can't tell you how many friends of mine who I would probably wager a guess that most of them know all of you. They're members of our community. They are leaders in our community who I've had conversations with privately, who have expressed serious warning signs for mental health distress, up to including addiction issues, suicide ideation. And these are folks who on the outside you'd think are one of the most strongest people of your friends network. So if those folks are dealing with that, I would be shocked if the people I'm talking to right now are not dealing with their own. And when I've asked them why they don't talk more about it, it is entirely about the stigma. That they don't feel comfortable admitting it. And that's just silly to me. So if having a more of a conversation starts to bring down this, to bring down that stigma, then that's how we start to address this. So that's the kind of the overview plan that we're running with, and I'm hoping that you all would be willing to form a team, come up with a plan. I'm more than happy to help you do that. I like I said, I admittedly will say that it is an awkward thing to have a 5K virtually, but there's a lot of different things that you can do, and I'm totally open to ideas. It's our first one, so there's no real roadmap to follow. But the most important thing is that we're doing something, that we're talking about it, that we're raising money for a really great organization, and that at the end of the day, we'll start to save some lives. So that's it. I'm a brief person, so if you have questions, I'm always here to answer them.
Yeah, Jerry.
Yeah, Dan, it seems to me like these kinds of issues are really rooted in family. If you don't have a lot of connection, a lot of people to talk to, then you're in greater trouble. Is that really the kind of way it works?
I wish there was a silver bullet, because if there was, we'd just focus on that one thing and address it. It goes from a lot of different things. So one of the things I'll use as an example, not too long ago, there was some stories about Britney Spears online, and everyone kind of jumped on the bandwagon of making fun of it, or picking a side and poking jokes. And I reminded some folks that the people around you are listening to that. So if they're listening to you make fun of or poke holes at someone who's in clear mental distress, they're not going to come to you if they're having one. They're not going to feel comfortable doing so. And so, to your point, Jerry, talking about it amongst your family members and recognize that it's okay. It's totally normal. We have been under an enormous amount of pressure this past year that has frankly been unprecedented in modern time. The last time we had it was the early 1900s. And even then we didn't have anything that we normally have right now. So you have this weird subsect where part of the economy has been doing exactly the same, not have seen really an impact, and then everybody else is just trying to survive. All the while we're all pretending that we're not impacted, everything's normal, everything's fine, while the house is on fire. And at some point we have to start being honest that it's not fine. None of this is fine. And hopefully we can actually have a conversation about what normal looks like going forward, because normal really wasn't working for us the first time. I think I see Dawn's hand up. I don't know.
Yeah, I wanted to say, amplify a little bit a point you were making, Dan, which is it looks a lot of different ways, because I think we're focusing a lot in this conversation about people who, for maybe the stigma or fear, aren't reaching out to people. I also personally know of 2 different families in rural areas in Lane County who have an adult child that has gone stopped taking their meds and is completely off the rails. And there is no resource. I'm watching 2 entire families go down hard, because they are 24 hours a day on call, trying to keep this person from hurting themselves and other people. And not hurting, it's a state. If they were actually going to do something criminal, there would maybe be a response and they could go into the criminal justice system. Not that that's really a great scenario either for a mental health crisis. But for someone who's not about to assault someone, but is clearly in a horrible, horrible mental state, their entire family life is revolving around keeping this person together in 2 different families. And there's no resources. There's no resources because that person isn't committing a crime, and because there's no place to put them because they're not in the city. There's no, cahoots can't come, they're not in the city. So there's nothing for them. And I am just horrified at as you said, we're at the bottom of funding. So services are just not there, and the families are being, I don't even know how these people survive.
There is no safety net.
No, none.
You are walking along the high wire and you're able to place that next step. Great. If you trip, there is nothing below you. And that is the reality that we have come up with.
The stress that was already there was acute, and then you put COVID in. They're terrified of COVID because if any one person in this system is ill, they're all going down. It's just incredibly fragile and vulnerable.
The 2020 budget for Lane County set aside for the first time $1 million for a 24-hour crisis intervention center so that the law enforcement could take folks to this place and let them bring down the noise before they take them to either whatever the next step is. But they didn't allocate any money to build or acquire the building. So they got $1 million for this idea, but no money to actually put it together. So that to me kind of encapsulates the whole thing to me. But there's what we want, and then there's what we know, what we have to work with. Part of the problem with being the quote unquote person talking about mental health is it's always doom and gloom when it comes to Oregon and Lane County, and I don't want to be that. There is a lot of bright spots of hope that I latch onto. Our suicide rate in 2020 went down for the first time ever. That we went back and looked. So that's great. There is rays of hope in that we're working actually on a ballot measure now. I don't want to take up time going over it, but I will say I will be back to talk about it. It would be transformative. It's pretty clear that there's a groundswell of support that is changing the public opinion on this, and it from the numbers I've seen indicate that it's crossing boundaries from political and age and socioeconomic, and everyone seems to be latching on to this idea that we need to start talking about this, and that's great. That right there is the first step.
Kamau, you're next.
Can everybody hear me? Yes, I was just listening to what you're saying. I want to say I'm sorry for your loss. And I was thinking of ways that the organization could possibly be helpful. Did you have like a number or an email address that we can possibly amplify if possible, or we can let our community know like, hey, this is where you can go to get that kind of mental health assistance that you need?
Well, for mental health assistance, or do you mean the NAMI walk?
For the NAMI or the suicide prevention and stuff like that.
So if you're in crisis, you can volunteer your time for the Suicide Prevention Coalition. That's definitely something. And I'll create a series of links and I'll send them off to Kate so she can get them out to everybody.
Perfect. That would be very helpful.
The coalition, when I started with it, was mostly just a group of folks who were professionals in the field who used it as a way to talk about best practices. And we've really kind of changed that philosophy to be more kind of hands-on. So one of the things we're working on right now is a visual database that would allow you to, because we don't have a 24-hour crisis call-in center or a suicide hotline. So what we wanted to do was to create a visual aid where if you logged on the website and you're having an issue, and a lot of folks who have a suicide ideation believe that my story is not shared by anybody else, that my problems are not the same as everybody else. So if you log on and you, for example, sort of get me telling you my story of suicidal ideation, I may not connect with you. My story is not the same as yours, most likely, right? But if I'm able to log on and I type in demographics about myself, I'm 41-year-old male, skinny runner, who lives in Oregon, and all of a sudden I get somebody who is also a 41-year-old skinny runner tell me about his issues, then I have a connection there. And all that takes is a simple video database and tagging your story. So that we've been working on that. That's a very low cost, high impact solution.
Tim Felker, then Matt Vose.
I'd like to just gently ask a statistical question. What is the most prevalent method of suicide in Lane County, say?
It depends on if you're male or female. Men shoot themselves and women poison themselves.
And just because it's possible policy decisions going forward may have some impact on the availability of being able to do yourself in.
Oh, absolutely. Yeah. The data always, there's a bunch of myths out there. If one of the most common myths are don't talk about it, that's totally wrong. Every bit of data from everyone who's a survivor will tell you that the more you talk about it, the less likely they are to do it. The second is if you want to shoot yourself and I take away your gun, you're going to poison yourself, and I have to worry about the next thing. If you're going to do it, you're going to do it. That's totally wrong. People who are going down that road have a very specific preferred method, and if you remove the means to do it, they don't do it. It's that simple. Now, getting rural, white, middle-aged men to give up their weapon is a enormously difficult task to do.
Then you have a homicide instead of a suicide.
Yeah, or you have suicide by cop, which is also a thing. That's how my friend committed suicide. And so there's a number of different problems to go along with it. But means and stigma and talking and identifying pretty clear markers are the easiest way to save someone's life.
Matt, then Judy.
Yeah, I just wanted to thank you for coming and talking about this. It's pretty timely. I've had some friends that are having rough times, and actually last night was on the phone with someone till after midnight. They're not in Lane County, and they're a close friend, and they didn't want me to talk to anyone about it. I'm wondering, at what point do you need to bring in outside resources? They said they just wanted to talk through some issues, and then checked in with them again this morning, and they seem fine, but in a pretty dark place. And so I was kind of on the fence. What I hear you saying is that talking about those issues is talking more and more about them is the right way to go. But I do think that the database that you were talking about would be a great resource for people that I could recommend to that individual. And then if you can send out a list of resources for people that maybe get the phone calls.
Yeah, I'll definitely send a list of resources. What I'd say first is I'm definitely not a medical professional. Like I said, I came to this by accident. But what I will say from what I've seen and from everything that I'm surrounded by experts is that typically in other states, there's levels of resources that are available for a person like yourself in the situation where they can go to it for help. Where we are is we're essentially a volunteer Minutemen, where we are that social network, that safety net. So you are that resource, and so unfortunately that puts people who are not necessarily qualified, but if they're reaching out, that's the best step. That is the best thing. So what I've done with a lot of my friends is to just keep calling, keep talking to them, keep drawing it out, and being incredibly direct. Asking them, are you thinking about harming yourself?
Yeah. Point
blank. And going from there. But like I said, we tend to think about mental illness in extremes, schizophrenia and dementia and bipolarism and suicidal ideation. Those are horrible, believe me. But the daily waves on a beach erosion of our mental health for all of us when it comes to anxiety and depression and fear about COVID and vaccines and just the waves on the beach. It's there for everybody. I would argue. I would argue that it would be impossible to meet someone who has not been impacted by this, and so we don't have to think about mental health as those extremes. We are all meat and water in one way or the other, and the meat and water inside of our skull needs just as much of attention as our liver does, as our stomach does, as our every other organ in our body. And we just don't think of it that way. And we need to start thinking about it that way.
Yeah, I agree. Thank you very much. Yeah, this one was a direct COVID related. They live in rural Eastern Oregon and got COVID and are on the tail end of the quarantine, not being able to leave the house and just going stir crazy. So
I do know that some of the NAMIs are working on a COVID survivors group. That's difficult to put together to a certain degree because there's HIPAA and there's lots of other things going on there. But if they can get it to work, that would be,
That'd be great. Yeah. Well, thank you.
Thank you.
Judy.
All right, sorry, can you hear me?
Yep.
Great, Daniel, thank you so much for being here. I have two questions, if that's all right. I'll start with the first one. It's definitely concerning that there are so many mental health issues going on, and I don't know if this is a wrong connection to make, but I can't help to be concerned that, that mental health realm plays a role in the, we know that there's been mass shootings that go on, and we know that that has to do with mental health as well. I can't help but think about those things when I go to the grocery store and just here locally. Is there that connection there, and what can we say the average person that would love to help and doesn't know how, what is the best thing that we can do to help that in our community? What can we do?
As individuals, the best thing we can do is advocate for more folks to make this a priority for the decision makers who start allocating money. I will say that there is some money coming from Salem. It looks like there's money coming from the federal government for housing. Over $1 billion is coming to Oregon. It looks like that is a breath of fresh air. But this is a big ship, and it's not going to be turned quickly. One thing begins to kind of spiral into the next. And so for me, really, it's about how do we have these conversations with our friends and family, and let them know that not only are we there to hear them, but that likely we're experiencing the same thing. I'm a small business owner. This week is the end of payroll, the end of the month, and the end of the quarter, after a year that was just bananas. And it was the most stressful year of my life, without any question. And there were plenty of times where I looked at, is this, maybe I should just, close up shop and hit the road. And I mean, this is just nuts. And if I feel pretty in tune with, keeping an eye on self-care and that kind of stuff. So you sit in meetings and they go over, warning signs, and you're like, okay, yep. Yep. So, if that's happening to me, I can't even begin to think of what it is for folks who not or are dealing with something different. I helped organize the Red Cross relief at Silky Field during the fires this past year. And we had folks who were being evacuated who, they haven't seen a human being in 6 months. I mean, literally have not been out of the house in 6 months, who are now in the middle of what could be loosely categorized as a refugee center. Some of them who were COVID positive, who the look on their face and how they were dealing with things was, an absolute trauma. They were completely traumatized. And now those folks I think about commonly are on couches, in hotel rooms, or on the street. That impact affects our entire community. Those ripple effects are not small, and there is nothing for them. There's no resource that we have at NAMI. There's no resource the county has. There's no resource the state has, or the city has that can shield us from that size of a wave. This is something that's going to take all of us pestering the hell out of everybody who sees a name on a ballot every few years, that they have to start looking at this as an epidemic equal to COVID.
Thank you. And I did have one more question just regarding your 5K. That's really great. You guys are doing that. I wondered what, is there a way to just, I know you said it'd be great to have a team and to have a fundraising goal. I don't know that I have the time capacity to do something like that, but I'd love to participate in the 5K. Is there a way to, to pay an entry fee and just simply participate in it, or what's the level of involvement?
I'll send that link out to Kate so that she can get it out to folks. What we've been having folks do is actually just create like a Facebook page if you want to do the social media route. So there would be a Facebook page for the community organization, and then everyone can kind of participate within that group, and and you have your own goal and how much you've raised, and then you're able to share it on your own page and have that virality go be a part of it. And then if you want to participate in your own way publicly, you can on May 22nd. If you don't want to do that, that's totally fine too. If you just want to walk your neighborhood or talk to your friends or call your mom or call your friends, that is the simplest way that you can do it. I mean, my favorite quote is that no raindrop believes it's responsible for the flood, but it is. So, every one of us are raindrops here.
Excellent. Great. Thank you again for being here, Daniel. Appreciate it.
So Ian and then Mary.
Hey, Dan, thanks so much for sharing that tonight. I just wanted to see if I had the right link for the event. I just put it in the chat. And then also I'm a highly competitive person, and I noticed that there's top teams. So could you walk us through how to create a team?
Yeah, I'll also put that in there as well. It's very, very simple. That is the correct link. So thank you for putting that in there. You can form a team individually. You can form it as the community organization. I've reached out to both the local Democratic and the local Republican Party to have some rivalry there. I'm all about using guilt. I grew up in a half Jewish, half Catholic family, so I have the guilt thing down very, very solidly. So I have no problem using that if I need to. So if we want to have it be Whitaker versus River Road versus Santa Clara, I'm fine with that too. But like I said, the money's great, and we are very thankful, especially in this time, for people who dip into their pockets. But ultimately, if all you do is make 3 phone calls and talk to friends who maybe you didn't before, the amount of impact that has is measurable.
Thank you. Mary.
No, Ian and Judy asked the questions I want.
Any more questions or comments for Dan? Jerry.
I'm just wanting your contact information. Would you be interested in presenting to my Rotary Club?
Oh, of course. Kim Myers, which is the central one here in Eugene. She's president of Rotary. As a good friend, and I've done folks with her. I'd be happy to. Yeah. All right. Which Rotary are you?
I'm Eugene Airport. Rotary.
Okay. Yeah. Love to.
Okay.
I'm putting my telephone number in the chat. Anybody can call me anytime. I also recognize just because I say we want to bring down stigma doesn't necessarily instantly make that happen. So there may be people who are on this call who don't feel comfortable having a conversation in front of everyone about this. I'm a pretty safe place. I keep much bigger secrets than anything that you could tell me. So it's totally fine to give me a call anytime you want and discuss things. And that includes needing to vent or just have, a person to talk to.
Thank you.
Thanks so much, Dan. We appreciate it.
Thank you.
Thank you, Dan.
Okay, so given that it's 8:25, we're gonna just bust a move on the rest of our agenda. Feel free to leave or stay as makes you happy. So, old business. I guess we'll start with, let's start with Dawn's proposal. Louis, did you have something to say, or are we waving? Just waving.
I was waving.
Okay, the Social Justice Committee. Let's start right there so we get that action item under our belts. So did everybody on the board have a chance to read the proposal Dawn set forward?
I can read it to folks. It probably didn't, it only went to the board because I think only the board votes on it. It's very short. And if I can find it, I'll read it. You'd think since I sent it, I ought to be able to find it pretty easy, right? There it is. No, that's not it. There it is. All right. Let's see. I'll share my screen actually. I'll do that. So Martha and Gary Holiski and I have met to talk about, if you recall at the last month's meeting, we talked through some of the issues that had happened in the River Road and Santa Clara communities around hate and bias incidents and the difficulty we had moving quickly in response, and let's just say the idea was to, oh, Louis shared it. Thank you, Louis. We talked about the idea of forming a social justice committee. River Road Community Organization and the Friendly Area Neighbors both have social justice committees. And we wanted to consider starting one ourselves. And this is a preliminary statement of purpose that we are asking the board to consider and offer amendments if it needs to be amended. But basically, we're asking the board tonight to approve the formation of the Social Justice Committee. And here is the preliminary statement of purpose. The purpose of the Santa Clara Community Organization's Social Justice Committee is to provide the necessary follow-through to make good on the commitments laid out in our SCCO Diversity and Inclusion Statement. Follow-through will include, but not be limited to, education of SCCO members and our community, person-to-person support as needed, referrals to social justice resources available in the greater Eugene-Springfield area. The Social Justice Committee will develop a formal mission statement as part of its future evolution and work. So it's kind of basic, and our first order of business, if the board decides that they want to form this committee, then our first order of business would be to set up a bias and response, I guess a bias response process, so that we are more nimble should in the unfortunately likely event that another kind of incident were to arise in our community.
So are you looking for a motion?
I'm first going to ask if there's any discussion that wants to happen. I guess I'm happy to entertain a motion. I'm happy, I'm happy to make a motion, or happy to discuss first if you want. Yeah, Jerry.
Yeah, it seems to me like at this point we're just trying to decide whether we want the committee.
Yes.
And if that's true, then I move that we do form a social justice committee.
I second. Any discussion on that?
Yes, we need a second from somebody else besides Kate.
I second. I second it.
Okay.
So on that, what would that mean then, as we're talking about this, to form a committee to follow up on this statement, or just what does that look like?
Well, to begin with, Patrick, I think right now the committee would be Martha Johnson and Gary Holiski and I. That's who's been meeting so far. That's who, I guess, first we'd have to ask, our bylaws require a vote of the board to form the committee. And then the bylaws allow Kate to appoint a chair of that committee. And I'll just, spoiler alert, we've just already decided that we would ask Kate to appoint me as the chair, just to get us going. And then I, as the chair, would appoint the rest of the committee, which right now is Gary and Martha. So that's kind of how that would look. And then Gary and Martha and I would bring to the board and the membership our bias response approach, a suggested bias response approach that we are taking just from, mostly we're using materials, we're not reinventing wheels. We're using materials that the River Road Community Organization have already set up themselves. And we're certainly free to make it different as we need to, but we're relying heavily on materials that have already been developed by other community organizations to get started.
The second key element, besides the response, is education, not just of ourselves to keep learning, but of everybody, all the board members, board plus, general membership. It's yes. Something that Don, Martha, and I talked about a lot, and it's definitely needed.
we talked about having a regular standing agenda item on the monthly meeting where we bring a piece of information or thoughts from readings that we've had, or maybe guest speakers sometimes, but it might be short things, but just to make sure that the topic is at least mentioned at every monthly meeting. And we would be responsible for bringing that education every month.
I appreciate the leadership you guys are providing on this.
Yeah, that's great, you guys.
Thanks.
And so one of the first items then would be the mission statement
Yes.
for the next meeting.
Yes.
So, something formal about, you know, the education piece and the response piece.
Yes.
Hey, any other questions for Dawn about it, or should we proceed to a vote? Okay, all in favor of, there we go. All in favor of forming a social justice committee, raise your hand virtually or with the yellow hoo-ha or whatever. Any opposed? Okay, unanimity. Go forth, do good. Dawn, here's my Tinkerbell wand. I hereby nominate you or appoint you the head of the committee. Ta-da! We'll make you a 2-2 another day.
Okay, cool. Thank you very
What
much.
about me? I want a 2-2 as well.
Excellent. You'll get a 3-3.
Thank you.
Yeah. Okay. Let's see. And of course, I'm sure Dawn and company are open to anybody who wants to join force. Yeah.
Yes. Oh, yes.
Okay. Old business, Santa Clara Foundation nominating board. So to date, there is myself and Patrick, Tim and Jerry have volunteered to be on the nominating board. And if there's other people who want to be on the nominating board or who would like to help suss out people in the neighborhood or other people who would be allies in the process of the Santa Clara Community Foundation, this is a good time to reach out. We are also in the process of trying to create a Santa Clara Community Foundation board member application form that has information, you know, asks people information about themselves that would help us evaluate their suitability for serving on the board. So if you have suggestions for specific questions that you think would be really important or critical to sussing that out in people, please pass that information on. You could send me an email, and once we come up with a completed application form, we'll be sure to share it back. Let's see, was there more on the foundation right this moment? Jerry or Tim? Yeah, Jerry.
It seems like that application form is critical to get finalized like ASAP and get it out. Just put it out on the website, on the social media, and anybody who wants an application to pass on, to fill out or whatever. And I envision the nominating committee just being the people who sort of triage the applications that come in and pick the ones that are particularly relevant. But we don't have to do that. We can get, I'm not sure there's going to be a whole bunch of applications, so we can just get those straight to the board through however means they want. They want to mail them in or email them in. And then the board can look them over as a body and make decisions about who they would like to then nominate and then officially vote for.
So then I have a quick question, because 2 weeks ago I sent you, Tim, and you, Jerry, a beginning list of questions for the application, and I haven't heard anything from either of you about whether you think those are the right questions or different questions, or any thoughts on, should I just make a draft and send you a draft of an application, and then anybody
The draft of the application that I sent a month ago?
No, this was
I
a
sent
list.
again a couple days ago.
Okay.
I haven't heard anything from you. So, and
Okay.
Jerry approved the list of questions, or the list of not questions, but sort of qualifying items to look at.
Yeah,
that the person is supposed to kind of rate themselves on these particular things, sort of a 1 through 3 type of rating system. And that was fairly useful. And then there was details in there that related to a different organization, but easily transferred to the foundation. And it was a complete application, and I never heard from you. So
okay. I own that. I will get on it this weekend and get it back to you. How's that?
I would suggest that maybe this nominating committee actually needs to talk about this. Tim has some ideas, you have some ideas, which I haven't, evidently I didn't open or something. But anyway, if we do start with something that you come up with, Kate, that would be great. But maybe we should just kind of put this, make some agreements that this is where we want to go. Also, we're talking about a nominating committee and hoping that people will just suddenly, magically turn their names into us. We need to either reach out or figure out how we're going to get people to nominate themselves, or at least to apply for this foundation board.
and we've had a couple of people interested. Kamal's interested, so he'll get an application for sure. And I think,
Go ahead, Tim.
oh, sorry, I think I muted myself by accident. So that makes sense. So really, the nominating committee, if anyone else wants to join tonight, then we should have a separate meeting and discuss the couple of documents that we have now that will represent the final application, and just finalize it. It shouldn't take us more than a meeting to do that, because all of the backbone is there, both what you sent, Kate, and what I sent previous. So and once that's done, then we can open it up for nominations, because people can't do anything until they have an application form.
Yep.
Okay.
Okay.
So
So
anybody else interested in reviewing this application form with Kate and Jerry and I?
And Patrick was on the list.
Patrick.
Okay, sounds like the 4 of us.
Okay. All right, so do we want to continue with election of board officers, since we only have our board here and many of us are already the officers? Or should we put it out another month and try to do our best to get more people to show up and have it as a general meeting and then elect our officers? It's a question.
I would support the latter.
General, what do you want to do, people? More than just Patrick? Anybody?
General, sounds good to me.
Okay, so that's what I'm hearing, is we'll put it out a month and it'll be incumbent on every one of us to try to get more people to the meeting, have it be a general meeting, and do officer elections then. Yes?
I'd just like to mention that the board officers are not elected by a general meeting.
Okay.
It's only elected by the board.
But we're electing board or board officers?
Board officers.
Oh, I thought we were electing board members. Sorry.
No,
No,
board
we
officers.
already did that.
And so that's only board members that select their officers.
1, 2,
Right, and we can do that right now.
6.
Right.
Okay. Who would like to serve?
I nominate all you all for all the stuff.
That's right. I'll be anything but the secretary.
I nominate Tim for secretary.
Does anybody on the board want to serve as a board officer who isn't already serving? The silence is profound. Okay. Well, Jerry and Tim, do you accept being nominated to continue serving in your positions? Or would you like to unseat me?
I'm happy to continue as the nominal vice chair, but I'm happy if someone else wants to have a board officer position too. So,
Yeah.
but to keep things simple, I'll stay where I am.
And I have learned really from the Russian Communist Party that the secretary is actually the person that actually runs the organization. So I'm happy where I am.
So are we.
Okay, so I hear moving the same slate of officers forward. That's a
Okay.
motion. Do we have a
And
second?
is it just the three, or is there a treasurer too?
Jerry does both, secretary, treasurer.
I'll
All right.
second that.
Okay,
Didn't you move that?
I said,
Okay.
I think Patrick moved to bring forward this slate of existing officers, and I just seconded it.
Okay.
okay, all
you,
in
Dawn.
favor? All opposed? Okay, passes unanimously. Tick it off the list.
Enthusiasm, Kate.
Yeah, I love you. Okay, so let's see. Michael is not available to be here today, and he would like to have a formal Santa Clara Land Use Committee. So we will put that off till next month when he joins us again. We do need to approve the February and the March minutes. And do we have to do them separately, Jerry?
Yes,
can-
you would.
Okay.
Yeah.
I moved that we approve the February minutes.
I have discussion about the February minutes because it mentioned something called the Santa Clara Timber Company, and such an entity does not actually exist. That was more of a sarcastic comment. So at the very least, that should be in quotes, air quotes. So just if someone comes upon those minutes later on and they, well, what in the heck is this timber company? Oh,
Yeah.
and I have something else to offer while I've segued into this, is I have a friend, doesn't actually live in the neighborhood, but he does some woodworking and he's interested in building a bench. And I said, well, maybe I can get you some wood if you build us a bench too. And he said, yeah, I can build 2 benches and like for the park. So they're kind of like half rounds with planks and a back and pretty nice looking rustic type benches. And so I throw that out in case that's okay for me to go ahead and tell him to do that and commission some wood for that.
So you're saying there is a Santa Clara Timber Company?
No, well, I guess, well, no, not officially. There's no money changing hands. We're just doing this kind of a trade thing. Now, if we want to do something like that, then we should actually sit down.
You're in the middle of the minutes, adopting the minutes, Tim.
Okay, so, okay, fine.
Okay.
Other than that, the minutes are fine.
Okay, all in favor of adopting the minutes as written with the one air quote change? Signify.
Right.
Okay, pass. Thank
Make a
you,
motion.
Jerry.
Make a motion for the March minutes.
Don, do you want to second that?
I'll second that. I do have a point of discussion. I would like to profoundly recognize the yeoman efforts of Jerry Finnegan in learning to spell my last name correctly. And he has indeed accomplished this task. And I salute you, Mr. Finnegan.
Hey, Jerry.
Way to go, Jerry.
We won't tell the Retired Teachers Association how many months it's been. But
After all that back and forth, nobody knows how to spell your name, Don.
not like it's a long Polish name with lots of Y's and Z's.
Nope, but we got there. I'm just glad we got there.
Yeah.
I just for a point of order, I need for the minutes to know who has moved to pass the February minutes with the corrections and who has seconded.
Patrick moved, John second for February. Patrick moved, John second for March.
Okay.
All in favor of accepting the March minutes as written? Excellent. Unanimity. Go team. There's an announcement about hate and bias training opportunities. Dawn, do you have information on that?
I should, shouldn't I?
I'm asking, I'm not saying should.
I,
I put it down in the agenda because, see if I can find my notes here.
I know that Surge is offering upstander bystander training coming up, and the city's co-sponsoring with them. And board members and committee members are going to be invited to it. Do you have dates on that yet, Jerry?
No, there's it just talks about, it says, please email Judy Bowles at comcast.net to get on the waiting list to find out when it will be offered again.
I know it's coming. I know they're just about to issue dates for the upstander bystander training. Is a 2-session training. I think an hour and a half each session, and it's being offered twice, so you could mix and match. But anyway, so both sessions are being offered twice, and like I said, it will be available for free to board members and committee members of boards.
Well, when it comes out, I'm sure Rini will let us know, and I will forward it to everybody in case you don't get it.
Yeah.
Just for everyone's information, Rini announced to the NLC that in 1 week she's retired.
So Cindy will send it to us, and then we'll get it. But so if you're not on the board list and you want to be notified about the upstander bystander training, please send me an email, and I will make sure you get it when it comes out, the information about it.
And if you want to be able to go to the upstander bystander training for free, and the only thing standing in your way is being on the board or on a committee, I am forming a social justice committee. So I could be persuaded to bring you into the fold of our social justice committee, and then you could go forth and go get trained as well. So there you go.
Excellent. Let's see. Quick report from Aubrey Park Work Party. Gary Haliski.
Yes, this will be our final work party of the year. It's likely to be relatively short. I just walked through the park today. It is getting hard like a rock. It's gonna be a little tough to dig and a little tough to work in the garden, but it will be our last one. We'll probably spend 20 to 30 minutes discussing a self-guided tour on May 1st. We've got 5 or 6 people who have shown interest in that. The city's good with it. And obviously it won't be as huge as when we did the whole celebration with the Santa Clara Community Organization. We're just thinking of 1 to 2 tables, 1 table being Aubrey Park, 1 possibly being the Santa Clara Community Organization. And I'd like to see that, because I think we've got some, we've got the nonprofit going, we've got the Social Justice Committee going. So we've got some really important new issues that weren't there before. So it'd be nice to pull that off. But it's gonna be really simple. We're just gonna have stakes in the ground guiding people along the way. And then we have fantastic signs that Karen made years ago that has photos of the plants in bloom, if they're not in bloom that day, with a great explanation. And we just take them through the whole park. We take them back across, what do we call it? Devonstone Bridge, Brandy Glen, Lorna's Loop, and all the famous people back there. The place is named after famous people. So
I take it no hot dogs.
No hot dogs, no food. We'll just have some sanitizer there. We will have 20 plants, native plants to give away. So we'll have the scavenger hunt.
Great, thank you.
And Gary, Tim was talking about getting a bench made. We'd have to work with the city for that, wouldn't we, if we put it in the park?
Yeah. We just have to come up with a location. I don't think it's going to be a problem. Their biggest issue is the maintenance of it. And if we just sort of tell them, if it gets vandalized, too bad, it's gone. It's no big deal.
Right.
It's not like the stone benches we put in.
And
We can move.
hopefully not be too vulgar.
Yeah.
Okay, so community garden update, Peter.
Are you muted?
Yes, community garden.
Yeah.
We are in the process of negotiating a written agreement with the church, and also Huerto would be the third party. So there'd be three of us doing what we've been doing for 9 years. But it would be a written agreement. Sounds like from earlier discussion that insurance would probably cost us in the range of $300 for liability insurance. That would be a cost that we would cover from gardeners in the same way that we cover water right now. So within the next 10 days or so, I plan to go and have a discussion with the vestry of the church, who are the ones that can lay down any rules they want. They own the land. I anticipate things will stay pretty much the same. There may be some issues around our composting, but I believe that there'll still be composting going on. It just may not be as extensive an area as we have right now.
Or as accessible, apparently.
No, we're not going down to the west side.
Oh, yeah. Oh, yeah.
No,
So
that's
that was
not
part of the
in the
discussion
cards.
that I read.
Yeah, everyone I've talked to says, I think you too, says that's
I
not
agree.
really practical to do, and it's not practical. It won't work. So right now, the plan is to try and draw the map in the same way that it has been. And if we need to reduce the size of the area, then that's what we'll do.
I think that was a big issue for them, is that they thought that the garden area grew over 9 years to be very successful and quite large. So I think they don't want it to get any bigger, certainly. And so if we can minimize the reduction, that would be great, so that we don't have to do a bunch of work to minimize it. Then that would be in the discussion.
Yeah, exactly. Otherwise, everything is proceeding. And I would ask Madam Chair, re-chair, if we can have 10 minutes on next month's agenda for an action item. Because what I hope is I'll be able to bring back and have circulated to everybody the wording.
No problem.
Thank you.
And you've got plenty of money. The garden's got plenty of money to cover that insurance cost.
Right, that's good. Yes, cover water, and now we'd have to cover insurance also, but it's not a barrier. Any
Hey,
questions?
Peter, I have a comment to our earlier discussion with Ian and the group. Is it something that maybe we can present through you to Huerta for their vaccinations? If there's an opportunity to do something like that, maybe even at the church there, going forward.
What is the request that we would be making?
Just to see if they needed help getting their COVID vaccinations.
Oh, in the church, in the congregation?
Or somewhere else like there, no, at Huerta itself, from the garden center, if that's something they would like to see as a group.
Okay, we could probably just discuss it some other time in more detail, but we can definitely facilitate discussions with the church or with Huerta or both.
Maybe we should take a straw poll right now about whether we want to move forward with trying to follow up with the idea of doing a community vaccine clinic or not. I mean, I don't think we actually have had that discussion about what do we think as a group if we pair it up with ARCO and we manage to do something like this, or I can't tell from people's discussion tonight what the level of interest is.
From my perspective, it seems like the county with their mass vax is doing a great job, and the diminishing returns, that little events that are going to take a lot of volunteer effort and negotiating with venues to do it locally may be more work than we have people willing to put out the effort. And so I would say that we more make an effort to communicate the Max Vax events and maybe help coordinate some transportation if people think they need it or things like that. So I'm not in favor of trying to do local events, but I'm not opposed. If people want to, I'll certainly volunteer.
I would want to echo what the gentleman said earlier who was presenting, I think from the county. And he described the thousands of people who are being done at the event center. And I went out at LCC, my wife and I. And those lines just move right through. Anything we can do, like Kim just suggested, to convince people to go register, get in line, drive down there, and you get 2 shots 3 weeks apart, that does it. And that to me would be the best thing to do.
John, then Jerry.
I agree that those big venue sites are important and they are going to do a lot of the work of reaching the people who are motivated. And I also think it leaves out a lot of people who are harder to reach. And I think the benefit of I don't think there's much more important work that we could possibly do as a community organization. And I think to me, there's a social justice piece, there's an equity piece, there's a possibility of improving our community resilience piece, our networking as our viability as a community organization. I think it could be dramatically improved by the kind of outreach that would take, and that would and the kind of community building it would create. So
action item
is, I would like to see us put out a call maybe on the website and through our email list to say, we're considering this. Are there people in our extended, I definitely don't think this is something that the people on this call can make happen, just the 12 of us or whatever that are here tonight. But I would like to see us put it out there through all of the free networking we have available to us that says we're considering having clinics from May to November that reach harder to reach communities harder to reach groups within our community, and who among us is interested in helping volunteer with that. And if 40 people raise their hands, we've got a going concern. And if we get crickets out of that, then we don't. But I don't like to see us just say, oh, the county's handling it, because I think there's a lot of people, the kinds of marginalized groups that he mentioned are harder to reach. And the act of us reaching them, if we have a motivated group of volunteers, the act of us reaching them will make us a better organization and will feed right into those kinds of resilience activities we've been talking about forever.
Gary.
I would like to suggest that the way I got a shot was to go online, get an appointment. They reached me again for a second appointment. There is a fellow that's in a tent on Irvington Drive, just 200 or 300 yards down from me. I don't think he's going to go online or check our social media to find out how he's going to get a shot. By the same token, I'm not sure how he reached these people. And so I talked to Kate about this. With Whitaker, it's really, they've got a lot of people they can reach in a very short amount of space. We've got older people, we've got unhoused people in tents around here, and so does Lower River Road. So actually reaching these people actually might be more difficult than setting up the clinics. And so I'm not really sure where I'm coming down on this.
Patrick, and then and then Tim, and then I'll insert myself.
So
Just muted yourself, Patrick.
I did, thank you. I was cussing. So a couple things that we found out. We were in Florence last weekend, and we had another event there, about 1,000 different people. We had some leftover vaccines, and so our search and rescue contacted the Florence Police Department and said, hey, I know we have some homeless encampments around. Can we maybe go talk to them and distribute the vaccine? They're right around the area. Went out there and they were not interested. They said, nah, we don't know how to get a hold of you next time. This is a one and done, see you later. And so there's a reluctancy of that. I think what I'm trying to see, what I have been seeing, and I've seen a great success, and it's getting better. I will say that. Small groups, 50 to 150, let's say Huerta was to have an event. They bring their people in to a location. The county came out, with nurses, and we administered the clinic, and it was to that organization and their extended family. And so this was a really, for marginalized communities, it was a way for them to say, hey, we don't feel comfortable over here. We want to do this. The memory care facility that's down there, down the street from you, Jerry, that's great if they come in and they give them a shot and they come back in a few weeks. That's a small amount, okay? That's a small amount that can be done. I think instead of taking it on, in my opinion, this is just my personal opinion, is instead of taking on that we're going to do the community service outreach, if we can get our outreach to the right people at the county, because they are really focusing in on this, that will help. That we can have those type of discussions to say, hey, let's have these mini missions that we want to go out and accomplish. And they're doing really well on that. This is from what I have seen from the mass vaccinations. If that's not going to work, which we highly encourage, we can get down into a smaller venue, a more intimate venue, and a more trustworthy venue, because there's a lot of people that just don't trust us. You can throw a dart and I'm sure you can get that. But part of that is, how do we do that in the right way? And we don't have the bandwidth, I think, as an organization to muster up, as Jerry said, to go get all these. We might be able to go and muster up some of these, but I think if we utilize some of the things that we have in play with some of the bigger organizations, and the bigger organizations don't have to be thousands of people, 100 people, that can say, hey, we've got these people we'll bring here. Can you come take care of this? That's a big opportunity right now.
Tim?
And I totally agree with Patrick. And that's what our ask should be. Our ask should be to go out in the community through our social media and our postings and emails and ask folks if they belong to a group that is in need of organizing vaccinations. And then they become the liaison to the group because they're a group member. And then they work with us and we work with the county or whomever we need to work with to set up these things and we work with that liaison in that community to find out what would be the best approach for them to take and how we can facilitate that approach. That takes all of this organizational burden off us, which we don't have the bandwidth for, and puts it on those communities that say, well, you know, there's community leaders that are willing to take those tasks on and say, I'm willing to organize a group effort like this and then work with us to make it happen. Because we could make it happen between the people we have. But I just don't see us going out and seeking the homeless guy on the street and knocking on his tent and saying, you know, we're having an event, why don't you show up and get inoculated? Anyway, that's my comment.
I'm in the queue and then Dawn. So one thing that came to my mind while we were talking about it today is a lot of the what I would call our more local neighborhood houseless community spends time right around our Beltline overpass in the Santa Clara Square and Riviera Center area. And I have no idea if North Eugene High would be a reasonable outside location, but if we could have something, or Lane County could have some sort of clinic there in the parking lot or something, it would be a pretty easy way to blanket with sandwich boards, you know, for a week in advance, so that our pedestrian population can see that this is available, it's free, it's right here, we're here to help you, you know, that there's no way that our houseless population is organized enough to get 50 to 100 people together for an event. But if we put it right where they are, I think it's a higher likelihood that people would be organized enough to show up when they realize it's a life-saving event put on for their benefit for free.
I would agree, Kate. Now you have the LTD fallow parking lot right there that serves a massive area. And so I just think from my knowledge and what I've been hearing and being part of, there's major opportunities right now for this type of event. Farm workers, things like that, our rural areas, they're really trying to hone in on that kind of stuff to make sure that everybody who needs something and doesn't have the access gets this opportunity. And so I think now is the time to strike in a positive way, saying, hey, we've got some ideas. How about this? There's some pockets that we can do, and then we grow from there. To try to take on major events is a little hard, I think, in our bailiwick. For the biggest thing is we don't have a location. We don't have a community center that we can say we're offering this. And so this is the type of things that we could be part of.
John, you were next.
I think it's been said.
So do we want to, I mean, so the idea was also that we could partner with ARCO. So if ARCO has a strong desire to move forward, would we consider doing something together, smallish, you know, maybe not shooting for 500 people, but if we could target certain groups of people, so whether it's agricultural workers, Huerta de la Familia, whether it's the low-income housing projects that are over off of Ross Lane, you know, we could go and leaflet all those houses or apartments and say, this is a service that's going to be happening in the neighborhood, and ARCO does the same in their neighborhood, and we sandwich board for the pedestrian population so that there's some that are more like certainties, these organized groups, and then there's the sandwich board responders who are not certainties but are hopefully availing themselves of an opportunity. Then maybe we get an event out of something like that amount of stuff. How do you feel about that?
I think it's a positive way. And I think even if you have 50 people, you start small and you get a positive reaction and you get encouragement that people say, that wasn't as bad as I thought. Hey, how can I do this next or whatnot? I think that opens up the opportunity for betterment for the community, because we did 100 people this Tuesday, but we signed up 20 to 30 additional for this weekend. People that would never have done that, and people had no idea, or it was an opportunity. They'll tell two friends and they'll tell two friends. And so I think that was a huge win for our community as a large.
John, did you have your hand up?
Yeah, I like where this is headed, and I would just also add that there's a lot more, you know, we keep going back to the difficulty of reaching the unhoused, and I agree that's a difficult population to reach. And there's also lots of people in River Road and Santa Clara who are housed, but they're renters, or they're, you know, on the edge financially, or they don't have reliable access to internet, or you go ahead and list that they work weird shifts, or not lots and lots and lots of reasons why a lot of people in our extended community are not going to make it to Autzen Stadium or whatever. So I like that. I like the idea of starting small, and I like the idea of us working towards this. because I think there is a need, and there's not much more important work we could possibly do.
Okay, so maybe we should, if there are people who want to continue to move forward, we could create a group of people who want to work on it a little bit and see where we go. And I'll check with John Belcher again about, yeah, Patrick, are you volunteering or you want to?
A little bit of both, but here's what I'll offer my services is if there is an opportunity, if there's a group, I would be more than happy to put them in contact with our outreach people that do that and say, here you go. And it has been very successful so far, and they are ramping up to continue this. So I would have no problem to have a direct connection to that.
I wonder if George has any perspective on the elderly population who might need vaccination.
Well, just to give you there's been some really good information, Tim, out there, and I don't think the county-wide is getting that. And I don't have the statistics in front of me, but the elderly population is hugely percentage-wise been fully vaccinated. It's really kind of cool to see, and I think that's part of the telling situation is there's information, but you don't have all the information that's out there, and it's really good information. And for the amount of people that's going that have been vaccinated, either a single dose or both doses, and the 65 plus is huge. It's a really big thing, especially this weekend. You're going to get a lot of second doses for the 65 plus that have gone out there, and with the reduction and with the levels that they've had, it says, okay, if you're 45 and you're up, if you have underlying conditions, if you have this, if you're 18 and up and have underlying conditions, there's a lot of opportunities out there that people aren't really seeing. So I as a county, we are either 1 or 2 in the state each week on what we're doing to vaccinate our constituency.
Yeah, I see that. Go ahead, Don.
I would not be surprised if a disproportionate number of the, say it's 15% or 20% of the elderly that still need vaccination. I would not at all be surprised if Santa Clara is overrepresented in, I don't think that 20% is spread out evenly across the greater Lane County area, let's just say. I think rural areas and Santa Clara probably have a higher percentage of elderly who would not avail themselves of those mass vaccination clinics, would be my gut sense. George may know better, or others may have statistics on that.
We've had some issues with specifically, we had an event 2 weeks ago up to McKinsey, to get the communities up there. In Blue River in the morning, we had about 400 or 500 shots available. We got 150, 200 people. There was frustration because you couldn't sign up, and I will be the first ones to admit it isn't the easiest to navigate. We did a lot better in Leeburg at the McKinsey Fire Station. Got a lot of walk-ins. We're going to follow that up in a couple of weeks for the boost on that, and come one, come all. Whoever is eligible, let's take care of that. So part of that is people get frustrated. They literally did not know. They don't have the community resources to get that information, and then there was an opportunity of, well, maybe not. And so there was a lot of door-to-door. There was people communicating, and last minute 80-something-year-old going, well, okay, I didn't really know, but somebody said come show up, and it worked out well. So I think the next communication will work out even better, but that's part of what's been going on is there's just some unknowns, and when you're going into the system, it's super frustrating, and that has gotten a lot better over time.
Okay, so it sounds like we're going to at least explore the possibility of moving forward, and raise your hand if you want to be part of that exploration to see what we can manifest or not in cooperation with ARCO and Lane County. Okay, that's a start anyway. And so that's Dawn and myself. And let's see, anything from the bat phone, Dawn, given our late hour?
It's, again, one of the shortest reports on the planet. This many contacts through the bat phone, other than offers of extended warranty on a vehicle that doesn't exist.
Thank you. And land use applications is the same. We only have the same zone verification from Quail Crest properties. So thank goodness for that.
Which properties was that?
Quail Crest, it's one of those down on, by SCCO there. What are we gonna do shots and I'll try to be volunteer the day up. I can't take, gotcha, Louie. And let's see, are there specific requests for programs in the upcoming SCCO months? Please email me ideas or suggestions if you have any, because it's always helpful in organizing what we're gonna do to have more people thinking about it. Oh, and I just, one brief update. The neighborhood plan updated the Eugene Planning Commission last week, and that went pretty well. And we are meeting with the Lane County Planning Commission next week, Tuesday, 7 p.m. if anyone wants to tune in and listen. And
I want to compliment you on that. You did an outstanding job. I've been watching it on video.
Thank you, Haliski G.
Yes.
And the other thing I wanted to mention is that I had an unplanned meeting. I got a call from Reagan Watches, who works for the city in the microsite rest stop unhoused community part of the city government, with Mark Cosmos, who's the plan design, the park community, our Santa Clara Community Park design lead for the Parks and Open Space, because we had put in a request to ask about the possibility of having one or two sites for temporary housing shelter right up close to the schoolhouse to help quell the vandalism that keeps happening out there. And we finally had an actual stand out there meeting, Mark Cosmos, Reagan Watches, and myself, and we talked about the possibility of maybe having two motor vehicle home type as opposed to Conestoga's, not a full microsite and definitely not a full rest stop. And I haven't heard back yet. Mark's interested. Reagan Watches is definitely interested. Maybe we could get Dan Bryant to be have Square One be the overseeing nonprofit for that. And if all that is a yes and a yes and a yes, our part is going to be going around neighbor to neighbor to neighbor, knocking on doors, explaining the importance of having it there, that it would help stop the vandalism of this important resource that we're hoping to have to be our own and work on to be our community center, but that in the interim, we keep getting set further and further back from making that a reality by the opportunism of people who don't really see the value of that as a community resource. So it would be a way to secure the site without having to secure the site a different way. And it would be a little bit of a sell to the neighbors. I don't think it would be too big if it's only 2 sites. So I'm just letting you know. So when we need to ask people to come and knock doors, feel free to volunteer, because it'll take a little bit of convincing for sure. And the only bad part of that is that in our discussion, Mark Cosmos sort of offhandedly said, well, we're getting so backed up at parks. I think phase 1 for the community park won't happen before 2023 at this point. So it just says to me more and more that it's the right thing for us to be working on our own building out there and getting something up and going for our neighborhood, because it could be a very long time before we get a large community center and pool. Silver lining, we have a great opportunity.
Thank you for doing that, Kate. Thank you so much.
Yeah, so I'll just keep you apprised, but I just wanted you to know that that's on the horizon as a possibility.
Well, and how do people foresee this happening? Is there a contract these folks would sign that says they need to actually supervise the property if they stay there?
I don't think that is the idea, and it's not active supervision. I think that what's happening is people are breaking in at night because there's nobody there.
Well, talk about the people who are going to stay there in their motorhomes.
But people I think that just having them there, living there next to the site, will do the trick. It's not that they're required to get out and confront anybody. They will have a phone number if they would like to call the 24-hour hotline, you know, if something happens, and there is such a number. But it's not their responsibility to be policemen. It's
Peace Presbyterian reports, Peace Presbyterian is very clear that having just John there in his one Conestoga hut absolutely dramatically reduced litter and vandalism and vagrancy and a whole bunch of stuff that was happening in their parking lot. Just the existence of a person living there changed their.
And what is the agreement that that person has?
Zero. He just lives there. He doesn't have any official.
They must have to, so there's a word of mouth thing. Say you can live here, and you can't move out and let someone else move in.
Oh,
there's got to be some sort of agreement.
No, that's overseen by one of the nonprofits that do they coordinate with the city, they contract with the city. The city pays Square One, community supported shelters, Nightingale, all these other housing, they're social service basically, like to help.
Right, so you're asking them to oversee this site.
Yeah.
Okay.
They will be supported, just not by us.
Yes. Judy's had her hand up for a while.
What's that?
Judy's had her hand up for a while.
Oh, sorry, Judy.
Not directly related to this. I didn't really know where else it would fit. I know it's getting late, so I'll keep it brief. But two things, you talked about possible upcoming projects or anything like that. Just wondered if we have thought about ever doing like a community cleanup. There's like a lot of litter everywhere. Maybe the weather's getting nicer. Maybe trying to get the community together to just do some litter pickup or something. It's all over the place, and might be a project coming up here while the weather's nice. And the second thing is just wanted to see if it's okay to post about our monthly meetings, like when it's coming up to it on some of the groups that I'm a part of, like maybe like I have different like groups on Facebook for the Eugene community in Spanish, but I can put it out there that's specifically for the Santa Clara neighborhood. Just trying to get more people to know about it. Wanted to see what your guidelines are around that, or if before I put it out there, I just wanted to run it by everybody.
I think you're free to do what you want. We don't have any guidelines about how to, and there's no limitation on trying to spread the word.
And I think we encourage you to do that. And in fact, when we talked, we emailed back and forth a couple times, and I looked into doing Spanish language translations for website postings. And I didn't really, when I reached out for resources, I didn't really get any response back. And I can, in particular for our website, I can probably do some automatic translations, but those aren't going to be very effective. They're going to be horrible, in fact.
They're awful. Yeah, I did.
So we need to have somebody who's gonna review those and make the corrections that need to happen. And so if that's something you'd be willing to do too, that'd be great. But your other thing is just perfect. If you can take what we're posting and pass that on in whatever languages you'd like to pass it on, that would be great. And
yeah, I did the translation of the diversity and inclusion statement to Spanish, so that's on the website now. But I did want to put that out for, just again on those groups, and just so I'm clear before I share it, if people in our community had a place where they wanted to air any grievances or share what successes and projects they might want to see, this would be the appropriate place to do it for their neighborhood. Is that right?
Sure, either on our Facebook or our website. Anything that posts to our website automatically posts to our Facebook account.
Okay.
And so a lot of comments happen on Facebook, and that's great. And any comments that happen on the website that's a place to kind of have a little deeper conversation maybe about things that you want to see addressed.
I mean, like these monthly meetings though, in general, like if someone knew where to come to this meeting, they could come with the expectation that they could share something here. If they wanted to, they would be comfortable to do that.
Absolutely, yes.
Absolutely. Yeah.
Great. I'll start putting it out there. I've thought about that throughout the month, but I wanted to wait until this meeting just to double check on that, but I'll get going on that.
We would love to hear people with actual issues that we can help with.
Excellent. Okay, thank you.
And
And,
Judy, as far as the litter cleanup thing, if you want to take on organizing a litter cleanup brigade or an event, we're all for it.
Excellent.
I'd be in for it. I do a Heilman Park thing, so as the weather gets nicer, I'll probably do in a couple different events. Heilman Park is on the end of Heilman Lane, off East Beacon, all the way out. It's kind of county, but it's still in the neighborhood. And so I'm working on some invasive species projects there. So I will be posting work projects for that as time goes on.
Great. I'll keep an eye out for that, and I'll kind of wait to kind of see a little bit of guidance on that. And my availability isn't great for like the next month, but maybe like later in May or June, my availability is a little bit better where I could focus on something like that. And I'd love to put some effort into that. So I'll touch base when I'll start gathering my thoughts on it. Though when I have something a little bit more concrete, I'll let you all know.
Yeah, I'll post things as they come together.
Okay.
Anything else that people have a burning desire to say or hear before we can sign off for the night?
Just quick announcement, the Eugene Scottish Festival is planning on doing something, but it's going to be very scaled down this year. May 29th at the Irving Grange.
You're going to toss that caber though, aren't you?
I'm hoping I can throw stuff.
We'll look forward to seeing you in your kilt in any case, Louie.
I have an announcement that I just thought of about in the next election on the 18th of May, the Extension Service is going to have a funding measure for a 5-year funding plan, a continuation of what it has had and a bump up in some of the resources. That's 4-H and master gardeners and all of the things that the Extension Service does. So I'd like to be able to maybe put that up on the website.
Send us the announcement, Gary or I,
Yeah.
and it'll go up.
Okay.
Hey, thank you all for hanging in to the bitter end, and I appreciate all you guys do in our community to make it such a great place.
So it sounds like my friend can build a bench for the park, right? No matter where it ends up going.
I don't see why not. And if what your friend is looking for mill ends, things that are half round or whatever, there's a bunch of them parked out at the farm right now, waiting to be bench projects. That the thinking was I took them off the burn pile that they were on, because then we could make benches and sell them and use that to raise money for the schoolhouse project. So yeah.
Maybe if they're thick enough, we can check it out and see.
Yeah. Otherwise, just have Mike Lash cut you one.
Yeah, I will. Yeah. Thanks.
Okay, just a reminder about volunteer hours if you have any too.
Ooh, I will get them organized. For everybody, please submit your volunteer hours.
Thanks, everyone.
Good night.
Good night.
Hey.